Hello everyone and welcome to the session of the AI Nurses Network webinar series. Today we have a great speaker, Dr. Vivian Hui, who's a nurse based in Hong Kong, and she's going to talk about using artificial intelligence techniques in survivorship research. So welcome Vivian. I'll just stop sharing and so you can share yours. Brilliant, I can see your slides.
Okay. Welcome everyone. I'm going to spend a couple of minutes to share what I have been doing in the artificial intelligence in nursing practice, education, and research. First of all, I actually work on starting from domestic violence research, and then I slightly moved it to the nursing informatics, and also moving on the primary healthcare and how to apply artificial intelligence in the clinical settings. So basically, the first project that I work with AI is actually I use a lot of online health communities data, including like Reddit, Facebook, or some forums from Hong Kong and also from overseas to look at how those domestic violence survivors were trying to display or like to describe their traumatic experiences. So I starting to learn and use some text mining techniques or such as like some traditional topic modeling, network analysis, or sentiment analysis to explore their sentiments, their information, and emotional needs. And then starting from having like ChatGPT or large language models, right now we are also fine-tuning some large language models to predict these information and emotional needs at the same time. And then right now, our current project is also working on like domestic violence chatbot. And this chatbot is like we want to provide some mental health support and also some validated resources through like recognizing the risk of domestic violence and then addressing the help-seeking barriers and how to assess their immediate danger. The picture look like here. So you can see like we have a description about how the survivors were trying to seek help and how these chatbot were developed by our engineers team and also using the latest innovation technology called GraphRed by the Microsoft. And then we can summarize what kinds of relevant information or materials would be suitable for these survivors. And if they mention any about like suicidal risk or like any severe depression, we will also alert the nurses behind the scene to alert some emergent help. Another project is more related to the clinical settings. So we use the RAG, retrieval augmented generation, to summarize a lot of clinical guidelines in the hospitals. And then we try to fit into our nurse board by according to some validated guidelines and also make it much easier to read instead of flipping to the pages. So the nurses could actually quicker to find out the information online and also update the system quite quickly. We don't need to follow the traditional protocol, but also they can update like install this checkbox into WhatsApp as well and fit to the local contents. And then the next one is about using AI technology to improve nursing education. One of our workshop for our students were actually having a pitching experience. And then we have about like 200 to 300 students per cohort. One teacher could be like very impossible to grade their pitchings one by one. So that's why we developed this pitching script analysis to allow these students to like put their script here and then they can get the AI generated results to get the feedback. So how these data were collected, actually, we collected about 2 years, about 500 students pitching scripts scores, and then we also incorporate all the teachers' feedback into the system. So then we use the large language model to summarize and also use the latest Llama 3 model to develop this system. So then the students could actually train their tailor-made scripts at their home 24/7, and they can also get the prediction grade according to our previous grading. So they can also receive the general suggestions by the AI system. Another one is we use large language models to train the communication skills. So the students were divided into field groups, like 10 students in a group, and then they can use ChatGPT or DeepSeek model, whatever large language models they have. And they have a summary about like or some background information, like they have to bring a bad news, such as like brain death or like diagnosed with cancer, breaking a bad news to the relatives and caregivers. And they need to interact with the generative AI what kinds of communication skills or what kinds of phrases, how should I approach these patients or relatives, okay? And then they have to use prompt engineering to trigger the Gen AI how to think of how to plan their conversations effectively and how to merge some of the framework like the SPICE framework or therapeutic communication skills into their prompting. So through this process, the students were more engaged to figure out, okay, if there's some cases they never seen in clinical settings before, might be Gen AI is a possible way to seek out with, and also have some like pocket to use phrases to deal with some complaints or deal with some people admission with trauma. So at the end of my sharing, I just want to share like nursing is not a one-track career, especially because of the nursing informatics and also artificial intelligence right now are actually gaining a very great momentum. So our team also actively recruiting passionate nurses, masters, or any PhD students. So thank you, everyone.
That's great. Thanks so much, Vivian. Sounds like you're doing lots of stuff on AI. I just have a few questions to finish up, if that's okay. It would be great to know, as a nurse, how you sort of got interested in AI and started doing research in that area.
Mm-hmm. Yeah, that's a really great question. I think the first time I know about AI is actually from a academic body called AMIR. I was in my PhD year one, and I actually didn't know about it until people were starting to use some AI tools in their presentations, and then I figured out, okay, my research interest was domestic violence, right? So people from domestic violence are very sensitive and traumatized. So I was thinking like maybe when they seek help, they might want to have some non-judgmental interventions or non-judgmental tools to help them to speak up easier. So then I tried to do some qualitative interviews and looking at those help-seeking posts in the online forums and try to use some AI too. So that was my starting point. And I also affiliated with another project from my advisor. So that's why I learned Python, and also I learned some kinds of like computing skills and how to work with those engineers in my PhD program. So that's how I stepped into the AI field.
Sounds great. So, yeah, based on that, would you have any advice for nurses, who want to learn more about artificial intelligence and maybe do some AI research?
Mm-hmm. Yeah, so really a great question because like I always ask my students to have a LinkedIn account. One of the way is like you need to put yourself into the circle surrounded by like-minded people. So I still remember when I still working as a clinical nurse. I feel a little bit frustrated if I have some new ideas about technology or using some new tools because I don't have like a someone to share my insights until I got some friends who are like very pro AI or pro technology. Then you have a group of people sharing some latest development from the tech company or from the health tech researchers or clinical support systems. So then I realized you need to be seen and also you need to know the opportunity. So that's why like having a LinkedIn account is important. I think finding your fans club, like building your own fans club on AI, especially in nursing, I think somehow right now it's getting much better. I think 10 years ago it's pretty hard to have like nursing colleagues who are very into technology. Yeah. What else? Let me think. I would also suggest clinical nurses to start working with engineers if they have this opportunity because the mindset from our field, like clinical nursing, and also the mindset from engineers could be very different. So you need some hands-on experience to translate our nursing theories or nursing concepts into layman terms for engineers. And then the engineers also learn from us how we make decisions. So then you can easily collaborate in a project and also you will understand how the system work, how the data collected, how the data were trained it. And then it could also improve our knowledge more, how we can criticize the AI in our daily life. Mhm.
Great. Thank you. That's some really good advice there. And yeah, I think I would agree with all of those points. So my last question then kind of has two elements to it. I'm just really curious, what are your plans for your own AI research? And then the really impossible question to answer, but I'm going to ask anyway, is where do you think AI will go in the future? And yeah, what kind of trends or applications of AI should nurses be keeping an eye on?
Well, maybe for the coming 2 years, I probably will still focus on large language models, or maybe more on explainable AI, like how to make it explainable, applicable, and using like maybe multimodal or large language model, like not only text but also audio or pictures to predict something. Um, so the next question is about like the challenges or like yeah, the challenges. I think one of the most important challenges is actually the accountability or like the bias issue. We're always trying to say like AI is reliable at some point, right? But they are not completely reliable. So in order to uh, develop the framework how to collaborate with AI, or like I believe that in the next 5 to 10 years we will have AI nurses working with us in the clinical settings. They might just be doing some like hands-on things or like non-invasive procedures. But I believe that we can see these days coming very soon. And how what would be the like the protocol to govern the roles and the responsibility of the AI nurse and also the human nurse, and how is the collaboration should work out? That would be a very important elements, and also the clinical staff were starting to think about it, about like the bias, risk, and ethical issues, something like that. Yeah.
Great. Yeah, yeah. There's lots of elements to AI that need consideration, and it's great that yeah, you and other nurses are starting to work in this field. So yeah, thank you so much for joining us, Vivian, and I hope the sun is shining in Hong Kong today. Thank you. This is the webinar series for the AI Nurses Network, and we'll follow up with another webinar from Nurses Doing AI very soon. So thank you very much.